Good afternoon, ma'am. My name is Miamie C. Asuncion, and I'm gonna perform ECG or the electrocardiography. The purpose of this procedure is to record the heart's rhythm and activity on a moving strip of paper or a line on a screen. The second purpose is to detect the abnormal heart's rhythm and to investigate the cause of chest pain. For the assessment, we need to assess the following: the doctor's order, client's level of consciousness and ability to follow instructions, presence of coins or other metals in the client's pocket or jewelries, the presence of chest pains and difficulty of breathing, and lastly, check the materials that we need for the procedure and check also if these materials are functioning well. For planning, we need to gather and prepare the materials that we need for the procedure: the ECG machine, the paper tissue or face towel, the paper strip, KY jelly, alcohol pad, bed with small pillow and top linen for dropping, and check the area or room to be used. For the procedure, we need to identify the client, introduce yourself, and explain the procedure. Instruct the clients to remove the following: coins or any metals, jewelries, loose clothing, and cloth with button or strap. Position the client in a supine position and draw the curtain. Set the bed in a comfortable position and lowering the side rails where you will work. Do hand washing and other infection control measures. And keep it dry. Ngayon po, isi-shave naman na po natin yung hairy part sa may chest ng pasyente kung saan po ilalagay natin yung electrodes. After po nun, nilinisin na po natin yung electrode site. Prior to apply the electrodes on the electrode site. Place left arm lead, yellow or black, on the left arm. Avoid the bony prominences or on the left posterior axillary line below the clavicle. Place right arm lead, red or white, on the right arm. Avoid the bony prominences or on the right posterior axillary line just below the clavicle. Place left leg lead, green or red, on the left leg. Avoid bony prominences or place below the torso. Place right leg lead, black or green, on the right leg. Avoid bony prominences or place below the torso. Place V1, red, on the fourth intercostal space just to the right of the sternum. Place V2, yellow, on the fourth intercostal space just to the left of the sternum. Place V4, brown, on the fifth intercostal space, in line with the midpoint of the clavicle, avoiding the bony prominences. Place V3, green, between lead V2 and V4. Place V5 block horizontally even with V4 but in the interior axillary line. Place V6 violet horizontally even with V4 and V5 in the mid-axillary line. Ensure that they have been placed in the necessary location prior to turning on ECG machine. Turn on the ECG machine and wait for the ECG reading. Katapos po na ma-reading ng ECG yung kanyang heart's rhythm, tatanggalin na po natin yung mga electrodes sa may arms and legs ng pasyente. And after po natin natanggal yung electrodes dun sa may sites, ngayon naman po ay lilinisan naman po natin yung mga pinaglagyan po natin ng electrodes. After natin pong magawa yung mga yon, we need to assist the client to get up from bed. After po nun, continue aftercare of the materials. So yung mga nagamit po nating materials sa procedure, kailangan po natin siyang itapon sa may tamang tapunan. And kailangan po natin mag-hand washing or mag-hand hygiene. After po natin mag-hand hygiene, we do documentation po. Documentation is very important para po proof na yung procedure po na yun is nagawa natin sa may pasyente. Kailangan po natin siyang i-document sa my client's chart. Rationale for identifying the client to ensure the right patient will receive the intended procedure and to help prevent errors. Rationale in positioning the clients in a supine position. It promotes client's privacy and aids in the proper taking of ECG. Rationale in lowering the side rails where you will work. Helps the nurse to work at ease. Prevents strain at the nurse's back. Rationale for hand washing. It controls and prevents the spreading of microorganisms. Rationale in shaving hair from electrode site if the site is hairy. It is because excessive hair prevents good electrode contact. Rationale in doing hand washing and other infection control measures. It is to protect the nurse and clients by reducing the transmission of bacteria and microorganisms. Rationale for documentation. Timely documentation helps to ensure patient safety, provides record of the client's care, and serves as the baseline for further management.